And when it comes to knee joints or total knees wearing out, let's say, and you mentioned before that the lifespan of the average knee, 90% for 10 years plus, 9% for 10 years plus. But when they do wear out, what's the reasons why they wear out? From what I've understood, it's often what we call aseptic loosening, which for those who don't understand what that means, it's to do with essentially you're putting the replacement into bone, and then over time that bone naturally degrades a little bit, becomes a bit osteoporotic, perhaps gets a bit weakened, and then the thing starts to become a little bit loose. Is that am I correct in that assertion, Joyti?
Yeah, I mean, I think when it comes to knee revision surgery, the key factor which you made is understanding why it fails, and you're absolutely right. Aseptic loosening is probably the commonest cause of knee revision surgery, but it's not the only cause, and it's by no means isolated. It could be aseptic loosening, but actually there could be other issues.
Yeah.
So understanding why the knee has failed, even if it is it's reached its lifespan of let's say 15 years, in fact this day and age we would quote predominantly knees lasting more than 15 years by an average, certainly a 1% reduction in longevity after 10 years. In terms of the key factors is actually component positioning, which is really important. That's one of the key causes for problems and key causes why things wear out quicker if the components aren't perfectly aligned. And again, that's where the
plastic components wearing out. Is this what you mean?
Well, it's actually so the plastic aseptic loosening, as you can correctly say, is the plastic, effectively wearing out. So just, metal on, hard on soft bearing, metal on plastic, you slowly wears. Those micro particles stimulate the local, what we call macrophages, the cells that sit within the synovium. They then release certain chemicals. Those chemicals eat away at the interface between either the prosthesis and the cement, or the cement and the bone, and over time you get micro movements and then effectively aseptic loosening. Yeah. So that's the underlying thing, but things can predispose to that. So if your components are slightly malrotated or malaligned, let's say, or your prosthesis is not quite, if it's you're going for mechanical alignment and the prosthesis is designed for that, but yet it's in varus and you're overloading one side than the other, then you may be speeding up that process. So those are the things that need to be addressed, as well.